What is this? This is not malignant. This is your own bone. It can happen to you. It can happen to any of us. Basically, it's an exuberant production of bone for reasons that we don't fully know, but as we age, we may develop areas of bone growth. That usually happens, is quite common in the mandible, in the inner aspect, lingual aspect of the mandible. Those are called mandibular tori. They can become quite large, actually very large indeed. Sometimes they're tiny ones, sometimes are quite large, and they do grow with time. There seems to be a preference for males versus females, and sometimes they can basically perforate through the mucosa and create areas of bone exposure. If that happens to you, definitely that excess of bone needs to be surgically removed. It's not a big deal. Many patients live with of these large bony protuberances, tori, without any pain. And again, they are not malignant. But other times they can become actually painful. If the patient needs a prosthesis, a removed partial denture, then it is advised to take them out so that the denture can sit properly. These large tori or exostoses, depending on where they are located, are excellent sources of your own bone if you needed some bone reconstruction for whatever reason, because they are packed with growth factors and bone morphogenetic proteins. They are dense. Oftentimes they have a cortico-cancellous component that has more cortical than medullary bone, than intramural bone. And so they can actually assist us in reconstructing areas where you have lost teeth, or that bone can be used as a block, or it can be used particulated for a sinus augmentation, or for any other type of bone reconstruction that you may need. Don't disregard them, because they are excellent sources of autogenous bone, which is the gold standard in bone reconstruction in the maxilla and mandible. Again, they are not malignant. This is your own bone, but obviously if you have a concern or there isn't any area of irritation or inflammation, you should always consult with a professional, with a dentist, a periodontist, an oral surgeon, see what the diagnosis and potential treatment may be. So these are excellent sources of cortico-cancellous bone. If you ever need them, keep them, that's my advice, because you may need them in the future for a bone reconstruction procedure. If they bother you or they become irritated or inflamed, then you may have to remove them. If not, keep them, because they may be useful one day in the future for a bone reconstruction procedure.